Tarik Jasarevic is a spokesperson for the World Health Organization. He joins us live now from Geneva. Good to have you with us. So I was reading a statement by one of the UN agencies, the Office for Coordination of Humanitarian Affairs, put out February 2nd, talking about disappointment and uncertainty. Do you share the disappointment that more people were not allowed to move through Rafah?
Well, we hope that these numbers will increase. What we really need is not only Rafah to be open, we need all the other referral pathways for patients. We know that most time efficient and cost-efficient referral pathway is through to West Bank and East Jerusalem, where there are medical facilities ready to receive patients. So we need that crossing also to open, but we hope that through Rafah we will be able to medically evacuate more people, as there are more than 18,500 people waiting to receive medical care elsewhere.
You say you hope. Have you received any commitment from Israeli authorities, any promise that they will indeed allow more people to cross through Rafah or open up other crossings that you referred to?
Well, we have been calling for opening of all crossings throughout the war. Now, what we need is, on one hand, we need security clearances and Israeli authorities to agree, but we also need countries to step forward and accept Gazan patients. So far, during the war, we evacuated more than 10,000 people, and majority of these people went to Egypt. After that, United Arab Emirates, Turkey, and some European countries. But we need also to coordinate with countries who are willing to accept. But Sami, I really want to make a really strong point that what is really should be focused now is to rebuild health system inside Gaza. So we don't rely so much on evacuations, but we try to have those services that are needed inside Gaza as we had them before the war.
And I'm glad you mentioned that, because I wanted to ask you, have you been able to get, as far as we know, there's been no flow of goods through Rafah, right? Have you been able to bring any medical equipment, goods, things that hospitals, health facilities desperately need? Have you been able to bring anything through Rafah at this point?
We have been able to bring medical supplies through whatever crossing was open in past weeks since the ceasefire, but there are some delays to get security clearance from Israeli authorities for some medical equipment, and we need that medical equipment. For example, there is a program starting at Nasser Medical Complex in Khan Yunis on limb reconstructions. It's estimated that 20,000 people in Gaza require major limb reconstruction. For that, we need orthoplastic equipment to get in. But again, we should rebuild health system in Gaza and not rely solely on the medical evacuations. Obviously, to save lives quickly, we will try to get as many people out as possible, because every day counts. But we need for that also countries to step forward and say that they are willing to accept patients from Gaza.
I'll just point out to viewers, Tarik, as we're talking, we're seeing some live pictures. That'll be on the left side of your screen there. Those are live pictures of what appears to be a UN a convoy, apparently of ambulances, that's coming in from Khan Yunis. So some movement going on there. Tarik, what about in terms of, you mentioned reconstruction of health facilities and homes. That requires material to be brought in. That requires construction equipment to be brought in. Is there any sign of that kind of movement that you've seen, that the Israeli authorities are allowing that type of reconstruction material and equipment to enter?
Well, I think all the UN agencies were saying that we need more goods to come in, all sorts of goods inside Gaza. We need all crossings to be open. We need goods to flow easily inside Gaza, because the reconstruction task will be immense. When we speak about health system, huge majority of health facilities have been damaged or destroyed. We need really to get health services back inside Gaza. We need to support health workers who are still willing to do their job. But for that, they need support, and we are ready to provide that support. We just need that humanitarian space to open completely.
And looking at the numbers you mentioned, over 18,000 people need to be evacuated for medical treatment. At the rate that was reported of 150 people a day, we had statements from the Office for Coordination of Humanitarian Affairs complaining that will take more than a year. At this rate, I mean, we saw, 5 people leave yesterday? At a rate like this, are you concerned that many more people are going to suffer or perhaps even die before they can ever get medical treatment?
Sami, according to Ministry of Health, more than 1,000 people already died while waiting for medical evacuation. People who have been approved on the list to get the services out of Gaza. So obviously, for everyone of those 18,500 people, and among those are 4,000 children, every day is important. So we need really, again, to get all the security clearances, to speed up the process, to get countries to be willing to accept patients. But at the same time, we need to rebuild the system so maybe some of those people can get those services inside Gaza. We evacuated so far during the war more than 10,000 people. Before the war, every day, between 50 and 100 people from Gaza were going to East Jerusalem, to West Bank, and to other places, to Egypt, to get medical treatment. So there was a very well established referral pathway for patients. We need to get that back, but again, we need to rebuild systems. If we look at the type of patients that were going out during the war, majority of people were having trauma injuries, but also lots of oncology patients, patients with congenital anomalies, people with cardiovascular diseases. So it's a broad range of medical conditions. And again, we need to work on both ways of getting people out as fast as possible, but also trying to get those services available inside Gaza.
All right, pleasure to talk to you. Thank you very much for your time and sharing your perspective on what's happening there, Tarik Jasarevic from the WHO.
Don't miss out. Get the full picture. Subscribe to Al Jazeera for reliable news, expert insight. Like, share, stay ahead.